Chair recognizes Supervisor Pareira.
Thank you, Mr. Chair. I'm not sure who's going to answer this question, so what do we know about the vaccines that we're going to receive from the state between now and when they kind of take over and implement their program? Can you give an update to the public? There's as you look at the numbers, we don't have enough for second doses, so people are going to be concerned. If you could share that.
Sure. And we do have enough for second doses. We've been making sure that when we give a first dose, we're committed to giving those second doses. So unless the state rescinds vaccine that they have already committed to us in writing, we will have enough for second doses. So I do want to assure the public that is our number one priority. We're not trying to make experiments out of Merced County residents. If you get a first dose, you took that first dose assuming you were going to get a second dose, and we're going to make sure that that's happening for every county resident that we have given a vaccine to, either through our Merced County Public Health pods or through the vaccine that we give to providers. So that's our number one priority. Just to explain how the vaccine allocation works and why it is so difficult to to forecast and plan is that on Monday, we're told by the state how many second doses we'll receive. On Tuesday night, usually into Wednesday morning, we're told how many first doses we've been allocated to receive. We order those by Thursday afternoon, then they show up sometime between Monday and Wednesday. There's no consistency, and it's, every day we have a new set of numbers to deal with, to plan for, to allocate out. We have over 10 providers we're regularly giving vaccine to, plus pods. But we don't know consistently what we're going to be getting week to week to week. So then we crunch those numbers between Wednesday and Friday. We get what the providers can give out between Thursday and Friday, and then Monday we start doing it all over again. And there's no consistency, there's no projections, and so in terms of what we will be getting from the state, we don't know. We've been asking for that to be shared a little bit more expediently, but that has not happened to date.
So I kind of got two answers there. One was that we have doses for a second dose for everybody who's received a first dose. But do we have those in hand, or are those promised to us? And
we have the bulk of them in hand for through February 19th. And then the subsequent for beyond that are promised, but promised in writing.
Okay, and so then when you talk about getting more doses from the state, that is in addition to the second doses that were promised?
That's right.
Okay, yeah, thanks.
Chair recognizes Supervisor Silveira.
Thank you, Chair. And so I can tell you, I'll say it because Dr. Sullivan's very nice. I won't say it. What we get from the state, we get lip service. That's what we can. I can guarantee we'll get from the state is lip service. And the reason I know this is I was on a call. I know that Public Health was on the call. Chairman McDaniel was on the call. So was CEO Brown. So was Congressman Costa, Senator Caballero, and Assemblymember Adam Gray. And we had a conversation with the department, the director of the California Department of Public Health. And what we got was about 30 minutes of lip service. Mind you, we preloaded them with the questions that we were going to ask, because we sent them an email saying these are the questions, and basically they did what they do, and they kind of danced all around it, and really we had no more answers. And so what I did learn out of it is that they really put the screw into Merced County is what they did, because their initial allocation, which I get it, and I understand that you have to pick a point and go, and the initial allocation of vaccines came to Merced County based on healthcare providers. That was whether I agree with it or not, I can understand you got to pick a point and go, because those were the most people in that first category. So it's like this 0.02%, right, is how they came up with this number. I don't want to get you buried in the details, but basically we didn't get hardly anything because we're a healthcare desert. Well, then, and we pointed out, but we could never really get them to, and I commend the Assembly member because he tried to get them to commit to at least on the record saying that they recognize the errors of their ways, but they wouldn't do that. But nonetheless, they changed the categories. They went from 75 and older, and then the state arbitrarily said, oh, well, no, now we're going to put 65 and older. And I don't want anybody to think that I just want to get vaccines for our residents. That's all I want to do. But when they changed that, they didn't change the allocation formula. It was still based on healthcare providers. So again, I just simply, at the end of the day, and I know I kind of went out on a limb because I know I got a lot of faith in our staff, and I'm proud that I just made the ask. I just asked the guy, hey, send us 10,000 doses a week for the next 4 weeks, and I'll guarantee you do that, we'll get them in people's arms. That's it, bottom line. And then if they want to, because they just kind of make up their numbers as they go, I told them, if you really, if you come up with your new formula and whatever the difference between the 10,000 we asked for and what your new formula comes up with, it was just basically paying reparations to Merced County. Because we talk about an equity piece, but yet the California, the state of California, it's just a buzzword for them. I really, and I couldn't shit, and I don't like to paint those broad strokes. There's some good people up there that are doing the good work. But as a whole, the administration, really I have issue with, because they talk about equity, but we check every box and are giving them every reason why we're not being equitably treated here, but that doesn't seem to work for them. So I know you guys are frustrated as well as I am frustrated. And back to Supervisor Pareira's question is, what do we get from the state? We get lip service. That's all we get. And it's not easy, and we're all trying to do the right thing here, but when you're supposed to have the horsepower in the room on that call, like it was like there were so many directors and deputy directors of everything going on in Sacramento on that call. I'm like, oh man, this is a call that we're going to actually get some stuff done. And in reality, it was 30 minutes of lip service, and then I forget her title, but she was going to end the call. It was like, okay, because you had some politicians on there, and they tend to like talk a lot. I'm one of those. And then it was like kind of after we said our piece and they kind of did their deal, we still come up with no resolution. And so I just hope that at some point that one of those people that was on that call, like when it comes time in this transition period between when we go to the third party administrator, like one of them's like, feel sorry for us. And it's like, you know what, maybe I can't give them 10, but we'll give them 9 or 8,000. Like at this point, I'm willing to take anything, because what they're giving us now, to speak to your frustration of having to try to plan on this deal where you're getting 2-3 numbers a week, and you got to plan, you got to set up these. We did a really amazing job of setting up these pods, these county stood up pods. It's 25 or 30 people. That it all has to be logistic. You have to plan for that. You can't. That just doesn't happen overnight. But we're in a system. If anything could come out of that call, just give us a consistent allocation. Whether if it's 2,000 or it's 1,500, just tell us what we're going to get for the next 4 weeks, so that we're not having to reinvent the wheel every week trying to figure out, how many do we have to keep back for second doses? How many do we have to be able to put in people's arms? It is so frustrating. And listen, I just think people call the governor's office, send emails, because it seems like Fresno County. I've been watching Assemblymember Patterson and city council members and everybody up there up in arms because the Valley got left out of a distribution site. Right? One of these large federally stood up. They're all writing letters, sending letters. All of a sudden, guess what? They're getting a new distribution site that's going to give them 6,000. I think it's like 6,000 a week. That doesn't seem like a lot, but it's 6,000 a week in addition to everything else they're getting just for that one distribution site. So it works. And we just got to be the squeaky wheel. I think the system is broken. I don't think it's right. I'm not going to allow them to be able to talk about equity and all these things and not really mean it. So I'm going to call them on that, and I'm going to continue to call them on that. But it's broken. But send letters. You can send them to me. I'll forward them on. Send them send them. And I know the assembly member is fighting just as hard as anybody on this. He's the one that set these calls up. But send them to the administration and let them know that we matter here in Merced County. So I know it was more comments than it was questions, Dr. Sullivan. But I feel your frustrations. And on top of having to do everything else, now we have to play these games of trying to figure out, how many do we have for next week?
Yeah, we absolutely share that frustration. I think to your point, if the choice had been made to go with healthcare workers at the beginning, we've been receiving vaccine for nearly 2 months. That's there's not an excuse for why in that 2 months the algorithm hasn't been assessed. We do quality assurance all day, every day, and that is a bare minimum expectation of something as important as this. They might have started off with an algorithm, but if that algorithm leads to the county with the 4th or 5th highest death rate getting the 2nd worst allocation of vaccine, your algorithm is wrong.
And I'm 100% positive that you shared that with them all along the way. It wasn't like, oh, we're just going to hold it back and then one day drop it on them. No, I'm sure on every one of those calls that you guys have been on with the state, you've been sharing this with them. And it's just, the system is broken up there. There's nobody that knows how to get stuff done up there. That's the problem. They all want to know it's science, but then it's not really science because then there's the politics involved and and yet my constituents, my bosses are the ones that are suffering because you have a willing population right now. A willing population. The people that are signing up, they want the vaccine. So it's got to be as easy as it's going to get is when you got willing participants. So I don't know other than I have a captive audience that gets to hear this rant, and I know that I'm preaching to the choir with public health staff because I know we've had conversations, but we got to keep being the squeaky wheel. So I guess I'm going to be good at it because it seems that's what's working. If we squeak loud enough, then maybe it buys us another 500 doses. I look at that's another 500 of my bosses that can get a vaccine. So thank you, Chair.
Thank you. And being on that call and being on a lot of calls with those top level folks and how we're negotiating, telling them exactly our story and going through and they're responding whenever Supervisor Silveira put the exact number and asked them, I want this, can I get this? And to watch bureaucrats scramble and move away from the question, I've never seen it faster, but it was fantastic. And the assembly member followed right up on it and was wanting the same thing. So it was very good.
Any views or opinions expressed on these videos are my own and do not represent the views or opinions of the City Council or City of Livingston. Unless, of course, I am using direct quotes or video from City Council or other public meetings, then it's pretty obvious whose opinion is whose. Copies of source documentation available upon request.